Poverty has been a persistent challenge in Nigeria, despite previous GDP growth trends and government's efforts to eradicate poverty. This deplorable condition has led to food insecurity, high maternal and infant mortality cases, diseases related to poor environmental health, low school attendance, and inadequate means of livelihoods, most times resulting in gender inequality.
The President has made the categorical statement that I want to commence the process of lifting 100 million Nigerians out of poverty in the next 10 years.
Though prior to now, various social safety nets had existed in the country, they were not adequately effective due to poor planning, coordination, targeting, and implementation.
Government was interested in addressing extreme poverty, and in addressing poverty and vulnerability, there is need for government to put program in place, and one of the programs that was put in place is conditional cash transfer.
In 2016, in collaboration with the World Bank, the federal government of Nigeria changed the narrative by designing and developing a National Social Safety Nets project, NASP, to reduce poverty and social economic vulnerability in the country.
To achieve that vision, the government of Nigeria is implementing several programs and interventions. The National Social Safety Net program is one of the government priority intervention. And the program has presence almost in all states. It also expanding over time to reach several million people who are currently in poverty, with the aim to support them to be able to support themselves.
The National Social Safety Net Project, NASP, under the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development, has two implementation units: the National Social Safety Net Coordinating Office, NASCO, and the National Cash Transfer Office, NCTO. NASCO is responsible for building the National Social Register, NSR, consolidating existing social safety nets programs, and setting standards, among others, at the federal level, whereas NCTO is responsible for financing safety net transfers to targeted poor and vulnerable households included in the National Social Register, NSR, delivering regular and reliable transfers to beneficiaries and with benefit levels that are consistent with the project development objectives.
We're seeing government demonstrating accountability through the NCTO office by providing information for people to keep an eye how the money moves from the central bank down to the beneficiary. Looking at this value chain, you can see that the role of NCTO is very important in all this. And so one of the things we have also done is keep an eye on the NCTO as an institution to deliver on government services.
The National Cash Transfer Program, also known as the Household Uplifting Program Conditional Cash Transfer, HUP CCT, with the catchphrase "Better Don't Come," is a monthly conditional cash transfer scheme to support the poorest of the poor and most vulnerable households, paid bi-monthly. HUP CCT, through the National Social Safety Net Project, has become a driving force for directly reaching the target populace to reduce absolute poverty and promote shared prosperity.
What the cash transfer is doing is giving cash to the poor and vulnerable. Now, there is evidence that when you give cash to a poor and vulnerable person, 68% of that cash is used for consumption. What is then consumption? Basic food and medicine.
Also anticipated, the NASP, through the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development, will institutionalize a sustainable system for providing social assistance to the poor in the long run.
For sustainability, this is not particularly an ad hoc program. It is a program that is being implemented by a structured ministry, Ministry of Humanitarian Affairs, Disaster Management and Social Development. So by the natural operation of ministries, there will be a yearly budgetary allocation, and that means the program will be sustained through this window of a structured formal implementation. The implementers of this program are intellectuals within the service already. It's civil servants within the ministries who are actually utilizing their know-how, designing and implementing, monitoring and evaluating, impact assessing, documenting and reeling out all the figures.
The Household Uplifting Program of the National Social Safety Net Program is a unique program of the federal government of Nigeria. But overall, it is a unique social protection intervention that Nigeria can build upon and can become a veritable strategy for lifting the majority of poor Nigerians out of poverty.
Social protection is one of the government's strategic policy actions aimed at combating risk, vulnerability, poverty, and other forms of deprivation. Cash transfer alone cannot manage the challenges of human capital development, capacity building, coaching, mentoring sessions on saving, group mobilization, life skills, and micro-business management at the community level are areas of focus in ensuring beneficiaries rise and remain above absolute poverty.
MOU was signed in 2016 with all the state government in Nigeria, plus FCT, to ensure that the implementation stage is at the state level. The staff at the states coordinates the program at the state and cascade it to local government level. That's why we have the head of unit in each state of the federation. We have officers there in charge of the program in the states. We also cascade to local government where we have desk officer and we have grievance officer at the state level. So the state government is fully in support of the program.
Each of this community is being reached by a CTF at least twice every month for activity. And our activities spread across training them, that's to build their capacity on savings and group mobilization. We also go for trainings on co-responsibility. Co-responsibility is just one of the activities of the cash transfer.
The program focuses on the poor and vulnerable households, PVHHs, in Nigeria. The PVHHs are identified through a combination of geographic and community-based targeting mechanism. Targeting is conducted by the states. Simultaneously, the National Social Safety Net Coordination Office, NASCO, supports and guides the process. The identified PVHHs from the process are included in the National Social Register. The data in the NSR undergoes a proxy means testing, PMT, used to rank the households from the 1st to 10th deciles according to their poverty levels, which defines their social economic characteristics. According to this ranking, households that fall within the 1st to the 6th deciles of the NSR distribution, equivalent to the absolute poverty line, which corresponds to those living below $2 a day, are eligible for the HUP CCT. Potential households mined from the social register based on eligibility criteria are enrolled into the HUP CCT through the following processes. Step 1. Community mobilization and stakeholder sensitization. This stage begins with requisite capacity building for state and local government staff to engage and sensitize the community leaders and members. During community mobilization, the community leaders are engaged with and sensitized on the aims and objectives of the HUP CCT program. The benefits and expected outcomes are detailed to the leaders. Engaging the community leaders with this information aims to get their acceptance of the program and support for the implementation process by ensuring the community stakeholders' buy-in.
Before coming to my district, we had to do some mobilization exercise that this program is coming, and I want people to cooperate with the organizers and the registrars, people that are coming into to the respective villages to do the registration exercise. And that mobilization exercise helped us a lot in getting people cooperating and going according to the concept of the program itself.
Since my about 40 years on the throne, I have not witnessed this type of thing. If any government had ever done this, I cannot remember that government, which shows that this government is unique, particularly in remembering the people at the grassroots.
This activity highlights poverty reduction through human capital development by promoting sustainable livelihoods and building the resilience of benefiting households and communities to withstand economic shocks and risks. Based on eligibility, the beneficiary list mined from the NSR is disclosed at a location chosen by the community members for unhindered access for confirmation and validation by the community members who had earlier identified the community's poor and vulnerable households through a community-based targeting (CBT) process for planning purposes.
So to raise the social register, or raise the social register in summary with a combination of three targeting mechanisms. One is the geographical mapping, the poverty map. The second one is a community-based targeting system which allows the community members themselves identify those who are poor and vulnerable that are then registered into the social register. And the third one is the proximity test that ranks these poor and vulnerable homes which are already contained in the social register from the poor to the poorest for any social intervention. So once it comes back, we already have a pre-programmed equation that takes the indicators that this we have received from the field, the information taken from this family, that then further matches those families within the register from the poor to the poorest. Programs like the cash transfer will then mine or target individuals from the lowest of the poverty pyramid.
This eligibility criteria corresponds to households that falls within the 1st to 6th decile of the National Social Register. So all households that fall within the 1st to 6th decile of the National Social Register are considered eligible for conditional cash transfer, and it is on the basis of this criteria that poor and vulnerable households are mined from the National Social Register for enrollment into conditional cash transfer program. Data capture of beneficiaries of the program is done electronically.
Beneficiary orientation. Another process during which potential households are enrolled in HUB CCT is by giving the beneficiaries basic orientation about the program. The orientation covers information including the background, aims and objectives of the programs, roles and responsibilities of associated parties, and information on the grievance redress mechanism, GRM, a tool for seeking redress on dissatisfaction with program implementation.
The grievance redress mechanism was established to receive and address grievances, especially from beneficiaries and even non-beneficiaries on program activities and implementation. The unit works in a way that we have structures from the community up to the national level.
This is really the beauty of the program, the grievance mechanism to put in the program. And what that grievance mechanism to seek to address is that when there is corruption, what happens? And then we are happy that some of these activities have led to government taking the initiative to launch a hotline recently by the EFCC and ICPC, that any government official caught trying to do anything that is not acceptable will find this way out. As we speak now, some government officials have been suspended. And this for me is something that's remarkable. And it does reduce the culture of impunity in the country.
During these activities, beneficiaries are guided on how to select an appropriate caregiver an alternate caregiver from each household without interference from the cash transfer facilitators, CTFs. The caregiver, preferably a woman, is responsible for receiving the benefit, cash and training, on behalf of the household. This function is expected to be performed by the alternate caregiver when the caregiver is not available. Data capture and issuance of program beneficiary identification card. The beneficiary's orientation is immediately followed by the electronic data capture of caregivers and alternate caregivers using a mobile enrollment application that securely draws poor and vulnerable household data from a central database. Based on the data gathered, program identity cards are generated and issued publicly to beneficiaries within participating communities by the CTFs under the supervision of the State Cash Transfer Unit. On payment day, each caregiver or her alternate presents their identity cards at the payment point in order to access program benefits. NASP Household Uplifting Program Conditional Cash Transfer Development Objectives and Priorities aim to achieve the following outcomes: improved household consumption, increase in utilization of health and nutrition services, improved school enrollment and attendance, improved environmental sanitation and management, assets and financial acquisition, beneficiaries engaged in sustainable livelihood.
Action Against Hunger Nigeria is supporting the coordinating office of the National Social Safety Net here in Abuja, and our role is mainly mainstreaming the gender and the social inclusion in the implementation of cash transfer household program. And I would say that every time when we receive feedback from the community is mainly related to the will from the whole community to be included.
When they kuziere anyị ejiri akwa were mara anyị atụ na ọ bụrụ na anyị eweta akwa ofu akwa na gịnị ka anyị ga-eji eme. So ọtụtụ shara ihe dị iche iche mana nchịkọta ya ofu onye sị na ọ ga-eweta akwa ahụ tinyere ya hash ya injin na hash ya na ọ ga-amụta nwa ọ mụta nwa ahụ ga-apụtakwa ọzọ ewere ya na-ama na ejikwe ibe ọla amụtakwa a na-azụta ọzọ.
The program has 3 components, accompanied by capacity building with coaching and mentoring to deliver timely and accessible cash transfers to beneficiary households. The first component is the conditional cash transfer. This provides a targeted monthly base cash transfer of 5,000 naira to the eligible beneficiary household mined from the NSR. The transfer is to help improve the consumption levels and to encourage them to develop saving skills. The overall objective is to reduce poverty, prevent vulnerable households from becoming poorer, and build their ability to be better than what they were before they started benefiting from the program. The second component is the top-up cash transfer, where an additional 5,000 naira is made available to a subset of the HUP CCT beneficiaries upon fulfilling certain conditionalities. Beneficiaries who qualify for the top-up cash transfer must participate in activities contributing to their human capital development and sustainable environment. Beneficiaries are expected to adhere to the specified conditions attached to the top-up transfer. These conditions are referred to as co-responsibilities. Each state is expected to pick at least one area of co-responsibility that reflects the state's challenges from the following sectors: education, environment, health, and nutrition. Eligible household for top-up must have one or more members who meet the following: education, children between 5 and 15 years old, and a girl child of school age 10 to 18 years old. Environment, household members between 18 and 40 years old, preferably women. Health, pregnant women or children between the ages of 0 to 5 years. Nutrition, children 0 to 5 years. The objective of the top-up cash transfer include the following: education, to increase children's school enrollment attendance. Environment, to address environmental hazards to improve productive assets. Health, to improve utilization of health facilities for antenatal care, postnatal care, and child immunization, to improve children's nutrition.
In addition to the first type of transfer that the beneficiaries are collecting, the program has looked at giving additional support to the beneficiaries to stimulate the demand for health and educational services in the area of improvement in school attendance and enrollment for the beneficiaries. Also helped pregnant mothers to attend antenatal and also take their children below the age of 5 for immunization.
The third component is the livelihood pilot. The livelihood component complements the cash transfers to support targeted households to move out of poverty. This facilitates beneficiaries' graduation out of poverty by ensuring that they establish sustainable income-generating activities that will make them self-reliant.
The livelihood comes towards the end, which is one of parts of the exit strategy. And the aim of the livelihood component is actually to create an enterprise mindset in the mind of our beneficiaries.
This component aims to build a mindset of enterprise development to reduce abject poverty in households and communities. It also aims at creating opportunities for work on farm and off farm, especially among women and youth.
Mo dúpẹ́ lọ́wọ́ Ọlọ́run, mo sì dúpẹ́ lọ́wọ́ wọn náà torí ìgbà tí mo débẹ̀ náà ni tọ́rọ́ kọ́bọ̀ tán fún wa tí n bá sanwó iléèwé àwọn ọmọ mi mo sì tó ra ẹ̀rọ tí mo fi ń yí mọ́ra wọn àtìgbà náà ebi ò pa mí mọ́ yẹn jẹ mẹ́ta lójúmọ́ àtèmi àtàwọn ọmọ mi.
When we go out to do the transfer disbursement to the people, we ask them how this has impacted their lives. We've had people, there's so many stories, I don't even know which one to start from. Some of them, they've started poultry. There's so much that they've started with them.
When this program was initiated, we thought that it was Nigerian case at that time. And it seems that time, if you watch them, those people, the beneficiaries, their social status have automatically changed. They can now feel belonged to the Nigerian society.
Onye hụrụ anyị na agbalagacha anyị hụ ndara beta don kom nyere anyị aka o nyere m aka n'ezinụlọ m beta don kom.
The fourth component is the capacity building. This is to enhance them for co-responsibility capacity. Beneficiaries are provided with capacity building in savings and group mobilization, SGM, life skills, LS, micro business skills, MBDP, co-orientation, and nutrition training. The Households Uplifting Program's payment system is a reliable payment system using payment service providers, PSPs. The PSPs are responsible for ensuring payment delivery and verification of rightful beneficiaries through a multi-factor authentication process. The payment process is divided into beneficiary banking, payment preparation, disbursement, and payment report, reconciliation, and funds return.
As soon as the enrollment process is being done, because we have a unit that enroll these beneficiaries. So as soon as the enrollment is being done, then the payment system generates the list of these poor and vulnerable households, and then which is being shared with the engaged payment service providers through a machine-to-machine communication. So there's no interface in this sharing of data. So as soon as this is being shared with the payment service providers onboard these beneficiaries by creating an account for these beneficiaries, either wallet or a virtual wallet. So as soon as these accounts are being created, the payment service providers shared back these account details with the payment information system, and that forms the payment database. So on the day of payment, the beneficiaries present this authentication token to the payment service provider's agent on the field. So as soon as this is being presented, the agents authenticate the beneficiaries. They have a mobile app which is installed on the devices. So when the beneficiary now presents the token, They now scan the token, and then it pop-ups the beneficiary's information. So once that is being validated, then the beneficiary collects his money.
The Household Uplifting Program, Conditional Cash Transfer, has enrolled 1,600,000 beneficiaries across 36 states and FCT. And enrollment is an ongoing process. It's a process among the activities of National Cash Transfer, which allow us to establish our National Beneficiary Register to be able to be part of the program.
The program ensures all activities are carried out as expected by building high-level capacity, making available adequate manpower, and ample trainings at all project implementation stages in the states, local government areas, LGAs, and communities. To ensure that set objectives are being fulfilled, indicators are disaggregated at the state and local government levels to track performance and identify good performance cases, as well as where additional assistance is needed.
There are a number of new monitoring mechanisms put in place. For example, there is now the team in the field, independent third-party monitoring, mobilized to all states from very independent point of view, including civil society organizations, independent from the implementers who are in the field, to go down on the ground and discuss with beneficiaries, discuss with local implementers, and identify what the gaps are, whether the program is implemented as designed, whether the beneficiaries are receiving their entitlement as designed, whether there are any leakages, any risks related to implementation or fiduciary issues.
The program target covers gender and people with disabilities. In the implementation process, gender and disability data are automatically taken care of when a household is identified.
The Household Uplifting Program has achieved the purpose for which it was established. Why? Because it has covered the whole Nigeria, now 36 states plus FCT. And looking at the number of beneficiaries, if you take the average, it has achieved to a certain degree the purpose, and looking at the time we had to ensure that it has gone around the country.
We've just started, yet there are these success stories. Sustainably investing this in the next 10 to 15 years, we will not only would have been able to successfully lift 100 million people out of poverty, but would have successfully designed and established a system that we are giving people a sense of belonging, a sense of livelihood, does not drop them to the poverty line.
Indeed, a cursory appraisal of the project shows a streak of success stories in meeting poor and vulnerable household identity field needs. In all these, trust and confidence have been sustained by a transparent and accountable relationship between the government of Nigeria, donor agencies, civil society, and beneficiaries. We are grateful for the support, contribution, and efforts of our partners and staff.